So we're in a season, continuous seasons of vaccination, because throughout the year, many people receive several vaccinations for various things. In seasonal infections like influenza, however, there are seasonal vaccines available, such as your usual flu shot. And people who are at risk, after discussion with their healthcare provider, might decide on having a flu vaccination as is recommended in adult patients. We're also in an era of vaccine hesitancy and anti-vaccine beliefs. Some of this is propelled by social media. Some of it has been propelled even within the healthcare profession because there hasn't been total transparency as it relates to adverse drug reactions after vaccines are introduced into man. And sometimes you get a lot of hostility. Many of my colleagues have been attacked on social media. Some of them have been, hopefully not many, attacked in person or accosted in person because of their vaccine beliefs. Suffice to say that trust in science has been eroded in the COVID-19 pandemic, but possibly even before that. What does the healthcare profession and scientific community need to do now, perhaps, is to respond to the hesitancy. First, explain again the principles of vaccination and why people are vaccinated and what they're vaccinated for. Secondly, be honest about the adverse effects that could possibly occur and warn patients of these, such that it's a risk-benefit decision that people make and they decide, okay, yes, I'm going to live with this risk of vaccination versus the risk of complication from disease. And if you do decide to get vaccinated, you should also make sure that this is at a vaccination site or from a authorized vaccination personnel, which would be either the Ministry of Health or your primary care doctor, usually your GP. Vaccinations saves lives. So in terms of some of the diseases I mentioned, every year, long before COVID-19, people died of the flu, which is why the flu vaccine came about. If you are vulnerable and you can't fight off infection as well as you would if you were healthier, vaccines help to do this. On top of this, many of us are still lagging behind in our COVID-19 vaccinations and boosters. If you are a high-risk individual, now is a good time to consult with your doctor and make a personal decision whether you want to be vaccinated or not. Vaccinations are now a personal decision, as they should be in all circumstances. Let's remember what happened during the pandemic when there was a lot of publication and publicizing of vaccines and new vaccines and which vaccine and what side effects, and many conspiracy theorists were out there saying the side effects. That happens with every vaccine that's introduced into man. But of course, COVID-19 was introduced, the COVID-19 vaccine was introduced into the age of social media. So it was anti-vaccine on steroids, more or less. And as a result, people really felt pressured and, dare I say, bullied into taking the vaccine. They felt they needed to take it to travel or to go to certain places, or what is my employer going to say if I'm not vaccinated? Now is a time where I think as a population and as a healthcare profession, we need to be realistic and sit back and explain to patients the risk-benefit of taking the vaccine and let it be an individual decision based on that person's individual risk to decide whether to have a flu vaccine, a COVID vaccine, an MMR vaccine, or any vaccine for that matter, including HPV. So vaccinations are conversations that should always be had with your healthcare provider. The healthcare provider should also provide you with any additional information that might be necessary to assist you in making that decision, but it should be an individualized decision. Caught in all this anti-vaccine has been childhood vaccines. And this is not an unfair kind of correlation, because you think that there's something wrong with one vaccine, there's something wrong with all vaccines. Of course, we know the history of the MMR vaccine and the history of vaccines in general. And parents have always been apprehensive. But before the massive movement against vaccines, people would still have vaccines done. Kids will still have their vaccines. There's been a fall off in vaccination in childhood vaccines as well. Many of my colleagues in pediatrics have seen this. There have been a lot of problems with children attending schools because of a preference not to have vaccines. This is something, again, that has to be addressed at a public health level, not nationally or regionally, but internationally. This fall off in childhood immunization has occurred. And the thing is, vaccines are an intervention that you don't see the benefits 1 year or 2 years from now. You see the benefits sometimes 5, 10 years from now. I'll give you an example of a common vaccination incident. When I was at school, all of us had the MMR vaccine. And everyone in my particular year across all schools in Barbados, so the first form group across many schools in this country, we all came down with mumps. The theory behind it is that probably that batch of vaccine was not as effective. When did we see it? At 11 years. You see what I mean? So it's years after you've had the immunization that you recognize that your immune system is not as strong to the virus. Note that I said it was our year. So class 4 students didn't get the infection. Second formers, it was just 1 year. So the immunization year was affected. And we see that playing out in other parts of the world, including New York with MMR and the outbreak of measles in that setting. So vaccines are something that none of us really like to talk about, the seriousness, the impact it has on public health, but it's something that we need to talk about.